Why do certain bacteria lead to UTIs in children? Imagine bacteria as tiny invaders trying to find a cozy spot inside the body. Some bacteria are better at sneaking into the urinary tract and setting up camp, which can lead to infections called urinary tract infections in children. The most common bacteria responsible is called Escherichia coli, or E. coli for short. These bacteria normally live in the intestines without causing harm, but they can cause trouble if they move to the urinary system. The urinary tract includes the kidneys, tubes called ureters, the bladder, and the tube called the urethra that lets urine out. Usually this system stays sterile because urine flushes out bacteria regularly. But bacteria like E. coli have special structures called fimbriae, which look like tiny hair-like projections. These fimbriae help the bacteria cling tightly to the lining of the urinary tract, preventing them from being washed away during urination. Once they stick, they can multiply and cause an infection. Other features of these bacteria help them cause infections too. They produce toxins and molecules that help them get nutrients and avoid the immune system. This makes it easier for them to survive and grow in the urinary tract. Certain factors make children more likely to get UTIs from these bacteria. For example, girls are more prone because their urethra is shorter and closer to the anus, which makes it easier for bacteria from the skin or bowel to reach the urinary system. Boys who are not circumcised also have a slightly higher risk when they are very young. If a child has structural issues like vesicoureteral reflux, where urine flows backward from the bladder to the kidneys, bacteria can travel more easily and cause infections. Poor hygiene practices, such as wiping from back to front, can transfer bacteria from the anus to the urethra, especially in girls. Not urinating often enough, constipation that puts pressure on the bladder, or using irritants like bubble baths and tight clothing can also increase the chance of infection. Once bacteria enter and stick to the lining of the urinary tract, they multiply and cause inflammation. This leads to symptoms like pain when urinating, frequent urges to go, fever, and pain in the belly or back. If the infection is not treated, it can move up to the kidneys, causing more serious health issues. In summary, certain bacteria cause UTIs in children because they have special tools that help them stick to and grow inside the urinary tract. Factors like anatomy, health conditions, and hygiene habits can make it easier for these bacteria to cause infections. Understanding how bacteria cause UTIs helps healthcare providers recommend good hygiene, encourage children to urinate regularly, and use antibiotics properly when needed. If your child shows signs of a UTI, it is important to see a healthcare professional for accurate diagnosis and treatment.